My name is Micah Rodgers, and today I will present to you glomerulonephritis. My objectives for this presentation includes describe the pathophysiology of glomerulonephritis, identify expected assessment findings indicative of glomerulonephritis, discuss diagnostic studies and procedures used to diagnose the disorder, discuss nursing interventions, discuss the treatment options, identify possible complications, identify expected outcomes. What is glomerulonephritis? Well, the glomerulus functions within the kidney. It is a very important part of the kidney. It allows urine to form as well as filtering the blood. Inflammation of the glomerulus is usually caused by an immune response. And as you can see, the reddened area to the right is where the glomerulus is found. It is inside the nephrons that are within the kidney. Okay, there are several types of glomerulonephritis. One type is acute post-streptococcal glomerulonephritis. Now, this disease process is usually found in children the ages 2 to 10. And it happens after a strep infection, so strep throat or impetigo, any strep infection that a person may have, this can occur afterwards. It occurs because antigen-antibody complexes collect in the glomerulus and it causes inflammation. Clinical manifestations of acute post-streptococcal glomerulonephritis are the following: hematuria, proteinuria, generalized edema, hypertension, and decreased urinary output. The hematuria and the proteinuria are exhibited because when the glomeruli is functioning normally, it is a semi-permeable membrane, meaning it is very selective of the components that are being filtered. Now, when the glomerulus is inflamed, it allows more larger components to filter that normally wouldn't. So this is why you will see the proteinuria in the hematuria. Generalized edema comes from the fluid overload. Now, generalized edema can start off just in the face and around the eyes, but as time progresses, it becomes more systemic and you will see it throughout the body. Now, the fluid overload comes from a decrease in the GFR, which is the glomerulus filtration rate. Now, the glomerulus filtration rate refers to the time it takes for the blood to filter through the glomerulus, and it should be, normal ranges will be 125 milliliters per minute. Now, the hypertension comes from also the fluid overload because of the decrease in the glomerulus filtration rate, and this causes sodium retention as well. The fluid overload can also lead to not just hypertension, but heart failure, renal failure, as well as respiratory distress. So by the decrease in the glomerulus filtration rate, this is causing congestion. The decreased urinary output is, once again, just from the retention, the sodium retention, the decreased filtration rate. The glomerulus is just not able to filter as it normally would because of all of this inflammation. Diagnostic studies include ultrasound, CT scan, renal biopsy, and urinalysis. An ultrasound uses sound waves to make pictures to see the kidney. The CT scan is a detailed X-ray used to assess the kidney for any abnormalities, injury, or disease. A urinalysis is a clean catch urine sample that is used to analyze for any hematuria, proteinuria, or any components that are found in the urine that will help them make a diagnosis of how the kidney is functioning. Now, renal biopsy, this is an invasive procedure. The other three are not invasive procedures. This is when tissue is extracted from the kidney and is used to examine microscopically. Now, there are some contraindications to a renal biopsy. Those who have bleeding disorders, a single kidney, hypertension, or someone who is using aspirin and warfarin. Now, before the procedure, you want to obtain a CBC, hematocrit levels, and prothrombin time. After a person has come back from the procedure, you want to apply pressure and keep the person on the affected side for 30 to 60 minutes. The patient should be at bed rest for 24 hours, and you want to monitor the vital signs every 15 minutes for the first hour. You want to assess for hypotension, flank pain, fever, and dysuria. You want to tell them to avoid heavy lifting objects for at least a week, and you want to let them know if they have to take anticoagulants, they need to consult with their healthcare provider before they start any medication that may thin the blood. With glomerulonephritis, you'll see some abnormal lab values. This will include an increase in BUN, which is blood urea nitrogen, as well as an increase in creatinine. Now, these two tests help detect kidney function. Creatinine is the most reliable test to detect kidney function. And when the glomerulus filtration rate is decreased, this makes the BUN and creatinine increase. So you'll see an increase in the blood urea nitrogen and an increase in creatinine. You'll also see an increase in potassium. Now, this is because there's a decrease in the urine output due to the decrease in the glomerulus filtration rate. And when urine is retained, this makes the potassium levels increase. Nursing interventions for glomerulonephritis are the following. You want to monitor the fluid status, monitor the weight daily, strict intake and output, restrict potassium-rich foods, monitor edema, monitor blood pressure, assess lung sounds. Now, fluid retention is something that these patients are struggling with. So, monitoring the fluid status and monitoring the weight daily, this is going to give you information you need on how the patient is retaining fluid. Are they retaining more fluid? Is the fluid being decreased? That's something important as a nurse that you should know. They have strict intake and output because, once again, we're monitoring that fluid status. Some patients may have fluid restriction because they're already at a fluid overload. So you want to know the fluid that's coming in, is it coming out? So it's very important to monitor the fluid status, monitor their weight, and strict intake and output. Restrict potassium-rich foods. Now, you want to restrict the potassium-rich foods because, as I mentioned earlier, these patients have a decrease in the urine output. And when you have a decrease in the urine output, you are retaining that potassium. So if they already have high potassium, you don't want them to eat potassium-rich foods because potassium, when it's increased, it can cause cardiac issues, and that's something that we do not want. So we do want to restrict those potassium-rich foods, bananas, tomatoes. We want to monitor the edema, and we're monitoring their edema because fluid overload can lead into heart failure, renal failure, and respiratory distress, and hypertension. So monitoring their fluid status and their edema is very important. And monitoring their blood pressure because it all ties in together. When there's edema, there's an increase in fluid, so this will make their blood pressure go up. And we're monitoring their lung sounds because that increased fluid can go to the lungs. So when you're monitoring their lung sounds, you're listening for any crackles or anything abnormal. Treatment options for glomerulonephritis are diuretics, antibiotics, corticosteroids, cytotoxic drugs, antihypertensives, and plasmapheresis. Diuretics are used to decrease the fluid overload. Antibiotics will be used only if there's a positive strep culture. Corticosteroids and cytotoxic drugs are used to treat glomerulonephritis, and the antihypertensives are used to decrease the blood pressure. Plasmapheresis is used to remove some of the antibodies. A complication of acute glomerulonephritis will be chronic glomerulonephritis, and this is a slow progression. It occurs over time, and it can ultimately lead to renal failure, which is another complication. So dialysis is going to be used to work as the kidney. So when the kidney is no longer able to filter the blood, then dialysis treatment will be used to work as the kidney to filter the blood. Now, once dialysis is no longer an option, patients may need to refer to a kidney transplant. My literature review is done on a 70-year-old male who had kidney cancer, and he was taking an autoimmune drug that was a monoclonal antibody, and it caused him to have glomerulonephritis. So in conclusion, it was basically saying how the adverse effects of these drugs, these autoimmune drugs, can cause glomerulonephritis. And the study was conducted by discontinuing him on the drug. And once he was discontinued from the drug, he began to take dialysis. And after 5 months of dialysis and steroid therapy, his kidney function improved and went back to its baseline level. So it is basically letting us know that these antibodies can cause glomerulonephritis. These are my references. Thank you for watching.